Welcome again, Dr. Todd Smith, internal medicine physician here in Princeton, West Virginia. And I am delighted that you all are listening to these videos. However, this video is going to be a little bit biased in that I'm wanting to make this video mostly for our providers. And that encompasses all of the physicians, the nurse practitioners, the physician's assistants, hospital administrators, people who are on the front lines on trying to keep healthcare together. So this one actually may not be for the standard patient that is not in the healthcare profession. I would love for you to continue to listen, and I'll encourage it, but I don't want to bore you too much. But this actually is going to be a little bit of a shout out to all of our providers out there. And that is, I am here to help this. We are tired as physicians of being responsible for the patient's care, yet we are being told every year that there's something new that you must do in order to practice medicine. Things that we're not even taught. Anything from a complex ICD-10 code. And for those people that are watching, these are codes that's used on patients for their diagnoses. So if you're diagnosed with diabetes, fine. If you're diagnosed with diabetes with hypertension, if you're diagnosed with diabetes with eye disease, kidney disease, we want to make that look a lot different. We want to make you look more complex, not lie, but the more complex we can make you, that's fine. Well, guess what? There are billers and coders, and that's all they do. We're told that if we don't bill right, and we get these little lovely forms that say, you know what, your billing is a little bit off of the standards across America. But how do you know what I did in the room? And I know people may think that there is a hidden agenda, and there is not. I am here because I've seen what medicine has been, and we're not talking about the medicines and our knowledge base and how that has improved over my 20 years that I've been here. I'm not talking about that. I'm talking about where we have continued to lose control, and we are having to do more and more and more and more and more to meet insurance and Medicare demands that does not have anything to do with patients. I'm not a person that says that I'm in control and by gosh, I'm the doctor and it's my way or the highway. That is not the type of person that I am. But also, I'm the type of person that as a physician, I want to go, I want to see my patients, I want to document what I feel like needs to be documented. I want to understand that it is not my problem that a patient comes in and has diabetes and they have nerve damage from their diabetes, retinal damage, eye damage from their diabetes, and if their A1C is not controlled, it's my fault. If I'm prescribing the medicines and if I am encouraging the diet and exercise and the patients don't do it, now they're going to talk about it's going to be my fault, maybe, with pay for performance. really. We're getting burned out. We are now being told that healthcare is a cookbook and that everybody should have a standard of medications, that the insurance companies feel like that that's what we're going to use. Guess what? It doesn't work on everybody. We're going to not be able to order a lot of tests that we need. But if we're in a rural area, that's going to be a little tough. We have lost control. We've lost it. And the AMA and the AOA, they are not helping this situation. It is time for us to come together, and we're not going to be a union and strike and protest. We do care about our patients. But it's time that we come together as a unified entity and that we make a change in this country. And I want to be that person that starts this process. I want no money from this because this can change. This can get easier, and we don't need all of the insurance companies making tons of money off of us. We don't need Medicare making tons of money off of us. We don't need drug companies making tons of money off of us. And at the same time, our patients can't afford the care. They can't afford the medicines. They can't. Really? It is our time to step up. You and I can do this, but we have got to come together. We've got to make a difference. You want me to come to your area and discuss some of my thoughts? I'm all for it. You want me and whoever to have a teleconference to discuss this? I'm all for it. Am I the person that has all the answers? Nope. But I've got the drive. I'm tired of it. It is time for us to make a difference. So, here's what we do. Email. You can email me. And if anybody wants to get in touch with me, email me, and then we'll talk about it. If you want me to come and if we want to start making some changes and we want to get together, that's fine. I will be happy to. It is time to make a change. The patients deserve this. The legislators cannot fix this. They don't understand this. And on a lighter note, I want to give a wonderful, wonderful shout out to all of the people in the healthcare profession. Finally, people do understand that, we're needed and they're appreciating us through all of this that's been going on with coronavirus. I just want to thank everybody. I've done a good job. We've done a good job. Now, let's fix this. Thank you for listening. Thank you for listening to my ranting and raving. And I encourage you to contact me so that we can get these things fixed.